Okay, if you can start admitting people now, Babita, just admit all from the waiting room and go to full screen again.
Yes, Anant, I've admitted all.
Okay, great, thank you. Thanks, and also go to full screen on the slides, please. Hi, good afternoon, everyone, and welcome to Sangat and Essence as part of our Policymaker Engagement Series. This is the third of our webinars that we are organizing in the build-up to World Mental Health Day and beyond, and we look forward to your active participation. Our speaker today is Dr. Saloni Sidana, who's the Additional Mission Director for the National Health Mission in Madhya Pradesh. I will introduce you to her in a short while, but I just want to give a couple of minutes for people to join. And in the meantime, I can maybe just give you a short introduction about this webinar series and about both Sangat and Essence. Babita, if you can go to the next slide, please. So this webinar series is being brought to you by Sangat. Sangat is a not-for-profit organization headquartered in Goa, though we have hubs in Delhi, Pune, and Bhopal. And as an organization, we are committed to improving health across the lifespan by empowering existing community resources to provide appropriate physical, psychological, and social therapies. Some of our primary areas of work are child development, adolescent and youth health, and mental health and chronic disease. And we are now almost 25 years old. ESSENCE specifically is a project with ESSENCE, which is a 5-year project funded by the US National Institutes of Mental Health, which aims to bridge the gap between science and mental health care services. The project seeks to generate evidence on cost-effective implementation approaches for scaling up of evidence-based interventions for mental disorders, in particular for treating depression. There are two components under ESSENCE. One is the scale-up component and the capacity building component. Next slide, please. The scale-up component is a research component, which is being implemented in Madhya Pradesh, specifically in Sehor, and it involves the development and evaluation of comparative effectiveness of technology-enabled interventions to train and support non-specialist health workers, such as ASHA workers and ASHA supervisors, to deliver healthy activity program, which is a brief psychosocial therapy for depression in primary care settings. This is a component that we are doing jointly through an MOU with the National Health Mission in Madhya Pradesh and the National Health Systems Resource Center in Delhi, which is a Government of India policy think tank in the health space. We also have a second component under the project, which is a capacity building component, which aims to develop and offer fellowships and online courses tailored for South Asia to build capacity of researchers, media professionals, policymakers, program managers, and service user representatives to disseminate mental health research and to enhance the uptake of research findings. So as part of this component, we are also doing these series of webinars with policymakers to speak to them about how they perceive mental health, its inclusion in policymaking, and how can we work with them to enhance advocacy for mental health within the larger health systems framework. Next slide, please. Just a couple of ground rules so that we are all on the same page when we do this webinar. One is kindly request all of our guests, participants to kindly keep yourself on mute throughout the session and keep your video off. You are welcome to ask questions in the chat window, or if you are following on Facebook Live, then through the comments modality, which is available on Facebook. The moderator, which is me for this session, will be collating all the questions based on the questions you sent in while you registered for this webinar, and also what you live asked using the chat window. And we will be asking these and to the speaker, Dr. Saloni, on behalf of all of the participants, once she's done with her introductory remarks. Again, any rude or inappropriate questions will lead to a participant being removed from the webinar, so kindly be careful about that. And just a reminder, very importantly, that all the policymakers who are speaking in these series are speaking in their individual capacity, and their views might not represent those of their employer, the government. So again, that's something we should be all cognizant of. Next slide, please. All right. Also, a reminder that in a few days from now is World Mental Health Day, the 10th of October, which is observed every year with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. This day provides an opportunity for all stakeholders, which is all of us working on mental health issues, to talk about our work and what more needs to be done in this space to make mental health care of a minimum quality a reality for people worldwide. So if I can take this opportunity to also introduce our speaker, Dr. Saloni Sidana. Dr. Saloni is an IAS officer with extensive experience in the health domain. She completed her MBBS from the Lady Harding Medical College and Associated Hospitals in New Delhi in 2012. She was a gold medalist in biochemistry, physiology, and forensic medicine. After she completed her MBBS course, she cleared her UPSC civil services examination in her first attempt in 2013 and achieved 74th rank nationwide. She's currently posted as the additional mission director of the National Health Mission in Madhya Pradesh. Dr. Sidana has been deeply involved in health policy making and in the Madhya Pradesh state response to COVID-19 over the last few months, including in the design of innovative approaches such as the use of fever clinics throughout the state. Dr. Saloni again is very keen on the need for further mainstreaming of mental health as part of government health services. And as of today, Dr. Sidana has also taken charge as the CEO of Ayushman Bharat in the government of MP. Dr. Saloni will be speaking on mental health issues in times of a pandemic. Welcome, Dr. Saloni, again. Thank you so much for joining. And we look forward to your introductory remarks, following which we will have a Q&A. So thank you so much for joining again, and over to you, Dr. Saloni.
Thank you so much, Dr. Anand, for this warm welcome. I welcome all of you in this series with Sangat and ESSENCE. This series talks about mental health, importance of mental health in the community. And I will be talking in my personal capacity as a doctor also and as a policymaker also. So good afternoon, everyone. I'll start from my days of my medical college. When we used to read psychiatry, I just found it a very interesting subject. That was the only thing I had in mind while reading the psychiatry. I did not know of the community implications of mental health disorders or any such thing as much as we were engaged in other subjects and seeing the patients of other subjects. To be honest, we were little engaged in the clinical side of psychiatry. But psychiatry I always found very interesting to read and interesting to imbibe. And the cool part was in internship time also, the psychiatry posting was very light. It was good posting when you had on one hand comparative postings like in medicine and surgery where you had to do 24 hours, 48 hours. Psychiatry was pretty light posting. So that was the interaction with the subject of mental health in the days of medical college as a medical graduate. The importance of this subject was not much known to me during my days of medical college. But then some thing happened, and my interest in this subject grew a lot. So one was that my best friend, she joined MD psychiatry and she started studying psychiatry as her master's. And second, I cleared my IS and I came to Madhya Pradesh cadre, and I started my service as an SDM, sub-divisional magistrate, in a Chambal region and in a district called Bhind. So that was my first participation and interaction with the community at a large level. So these two things when happened, I was very interested in health and taking up health infrastructure of the district and improving it and of my subdivision. So I used to feel that mental health component is very much of an ignored subject in the clinical side of health as well as in the community side of health. I started talking to my friend while she was pursuing her MD. Now she has done her MD. And my interest in the subject grew as we talked about it. And as I saw things on the ground, I saw that, you know, I studied in Delhi, but coming to this a very small district and region like Chambal, people had so much stigma attached with mental health, and they just did not want to talk about this subject. I mean, I could clearly see sometimes on my visit to hospital that this person is suffering from anxiety or say depression, but they would just not talk about it. They would say कि शायद कोई इस पे भूत है, या कुछ और रीजन होगा. I could see the person is schizophrenic, but they would not admit, people would not admit. The stigma around the mental health was so much that it shocked me to my core, that where are we living, where have I studied, and where have I come? So there's a stark difference between what I have been thinking of mental health till now and what is happening on the ground. So that time I decided in that in my further postings also and in my career also, I would be interested in this subject, and I would definitely try to bring about some change in the policies related to mental health and the execution of those policies at the ground level. So even I just felt when I was working in the community in Bhind and then in Chhatarpur, which are two Chambal region and Bundelkhand region of Madhya Pradesh, which are very so-called backward regions of country, that the people just don't talk about mental health, and no talk of mental health even in the clinic side. That's very surprising. Like, I can expect families not talking about it, friends not talking about it, but even when the patient comes to the hospital, they are treated like, okay, this might be something else, it cannot be depression, it cannot be anxiety, it might be something else. So the capacity building of the health workers was also, I felt, is a challenge in the community that needs to be addressed. So that's my introduction, and that's my then fondness for the subject grew, and I started taking interest in the subject. So as it happens, when you read a subject and when you become interested in a subject, first thing that you always want to know is that as a policymaker, what are the challenges that you are facing as government in the implementation of already already executed policies related to mental health, and why is government constrained in terms of execution of mental health programs and all about it. So I'll first talk about the challenges that we face in society as a government and as a layman also. I will talk from both perspectives. So first, as a layman, there's a lot of ignorance, I would say, about this subject. Believe me, when we study in cities like Delhi and Mumbai, and we feel like, no, people talk about it, stars talk about it, celebrities talk about it. But when you come to ground, you just understand that people don't even know about this. They just blame it on supernatural forces. They just blame it on some, their mood is low, or they some blame it on some family issues or things like that. They don't know that they are undergoing a mental health issue. That is the first problem. आपको बुखार होता है तो आपको पता होता है कि आपको बुखार हुआ है. आप उसकी तब दवाई ले पाते हैं जब आपको पता है कि हाँ, मुझे 100 बुखार हो गया है या 101 बुखार हो गया है. जब आपको पता ही नहीं होगा कि आपको कोई इश्यू है, तो आप उसकी तरफ प्रोग्रेस कैसे करेंगे? So that's the first thing, that people are so ignorant about the mental health issues and the prevalence in the community, that I felt ki as a layman, we all need to get educated about the mental health issues. Then, okay, fine. Even if I know about mental health issues, so what is the second challenge that I get in the community? For the challenge is the stigma associated around the mental health issues. There were times when there were words used for mental health disorders which were absolutely disgusting words. And even today, there's just one common word used for all mental health disorders in some communities and in some rural areas, which is very disgusting. So, the sensitization of the community per se, even in very developed areas, so-called developed areas, the sensitization of the community towards this subject is not there. And there is a lot of stigma attached to these issues. Even in the rural areas, in the communities, the people are just treated very differently if they come to know that this person is having some or the other mental health disorder. This happens, this is even more in, I would say ki in gender related things, that women, to be honest about it, women are treated even more badly if they encounter some mental health disorder, and they are treated like, I'm sorry to say this word publicly, but they're treated like witches. So this is the kind of stigma attached to the mental health disorders in our community. And if you don't accept that this is there, it is prevalent in the community, we are closing our eyes to the reality. So I think we should accept that there is a lot of stigma. A, people are ignorant about it. B, if they know about it, they don't speak about it because there's a lot of stigma attached to it. Even in colleges, if some young student or young professional in workplaces is going through some mental health issue, they would not like to disclose it to their peers because they think they will think I'm weak. They will not consider me for this promotion. They will not consider me for this assignment. So the people do not understand that our brain has an emotive component as a cognitive component. So while your emotive component might be thoda sa gadbad and might be having some issues, your uh, cognitive component might be perfectly fine. So you might be excellent and brilliant in studies while you are facing some mental health disorder. This type of knowledge is still not prevalent in our society, and that's why people just don't want to disclose what they are going through. They don't want to speak up about it. Okay, so first is ignorance, second is stigma around it, third is availability of manpower. I'll just tell you for my state and in personal capacity, I'm telling you, out of 52 districts in Madhya Pradesh, only 8 districts have a psychiatrist. Only 8 districts. Rest of the districts don't even have a psychiatrist. No psychiatrist at all. And we are running short of psychiatrists, even though we are offering them good salaries, we are offering them good accommodation, but we are not getting the psychiatrist. So there is an acute shortage of manpower. So even if I'm knowledgeable about my condition, my family is sensitive towards my health conditions, who do I go to? If I'm in a small district or in a rural district, who do I go to? मैं दिखाऊं किसको? कोई है ही नहीं. तो मुझे नीम हकीम के पास ही जाना पड़ेगा because there is no psychiatrist, there is no psychologist, there is no counselor. So acute shortage of manpower, especially in government sector, I can tell you, and especially in some districts, in some rural communities, rural areas, very far off flung areas, there's an acute shortage of manpower. So this is the third thing I feel ki this is a challenge, that availability of manpower is a problem. Now, if manpower is say available also, then training of that manpower and capacity building of that manpower is a big challenge. So if I say ki I have around 60,000 ashas in government of Madhya Pradesh, so I would say ki they are good manpower. Why not use them for mental health issues? But they have not been trained ever. When they were taught whatever they were taught, this was not even a subject to discuss. So they are not even aware if the person comes to them and the person describes some sort of mental health illness, they are not aware to take cognizance of that. So the training of existing manpower was the another challenge I saw in the community and in the government, that how do we train the existing manpower towards mental health issues, towards identification of mental health disorders, and the ongoing protocols of the mental health issues. So how do we train our existing staff? So this is the fourth challenge I feel that there is that's prevalent in the community and in the government. The most important challenge, however, I feel is that there is very less and a huge lack of community involvement in this issue. For example, अगर कोई टीबी हो जाता है या कोई और बीमारी हो जाती है, सारी कम्युनिटी को एक बार हम अगर इकट्ठा कर लेते हैं तो वो उसके पीछे अभियान की तरह जुड़ जाते हैं कि इसको हमको अपनी कम्युनिटी से निकालना है. जैसे लोग डिटरमिन्ड हो गए थे कि हाँ जी पोलियो का वैक्सीन लेना है एंड वी हैव टू गेट रिड ऑफ पोलियो. अभी कोविड के लिए सारी कम्युनिटी डिटरमिन्ड है कि वी हैव टू गेट रिड ऑफ कोविड इन वन वे और अदर. सो द डिटर्मिनेशन इन द कम्युनिटी to towards eliminating these diseases or to address these diseases, I would not say eliminating, address these diseases is still not there. That community involvement, that community determination, जैसे आप पल्स पोलियो की अभियान देखते हैं, आई डोंट थिंक आप मेंटल हेल्थ की अभियान देखते हैं. सो ये जो कम्युनिटी इन्वॉल्वमेंट है ये बहुत ज्यादा मिसिंग है. तो फ्रॉम अ लेमैन्स पर्सपेक्टिव आई वुड से कि दीज आर द चैलेंजेस I saw in the field, and as a government worker, I saw that these are the challenges in front of the government also, and how do we address them? That was the key issue. So when I became AMD NHM, so I was given in charge of mental health division in the state. So my first thing was, our first thing was that till the time we can't have the trained staff, the new recruits, we will have to train our existing staff. And that's how we got in collaboration with Sangat and ESSENCE. And their main motive was that we will train the existing staff to identify the mental health disorders, mental health issues, and that will start the talk in the society about the mental health issues. Because if the health workers are sensitive enough to identify them, and if they are sensitive enough to talk about them, then only we can have a talk about them in the society. So we have to act as forerunners and we have to start this talk. So as in the government, our policy was very clear. The policy was dual-fold, that A, we have to get people start talking about mental health, and we have to create awareness in the people. And while we are creating awareness in the people about the mental health issues, we have to train and build the capacity of our own staff also to help the people address these issues. So twofold approach is there in the government, that one, create awareness, let people talk about it, let people come out and speak about it, and two, have trained staff that when people decide to speak about it, that when people decide to come out of it, come and talk about it, we have health professionals who are there to listen, who are there to remedify, who are there to take them to specialists. So all these things are important. So this was the dual approach that we had in the government. I would briefly touch upon what kind of different mental health issues I felt or I saw in the community in the pre-COVID times. So every one of us at some point of time in life go through bad phase or low phase. How to distinguish between a general low phase, a general low mood, and say a disease, a mental health issue like depression. So the most important thing is that we have to take the duration of that particular problem, since how much time is it persisting, as a main factor to decide whether it's a permanent problem or it's just a mood disorder or it's just a low bad day in your life. So that's one. that how do we distinguish? There are other factors also. If we are having any family history, and we are having any uh, something which is not getting cured by counseling, then obviously there's a need to approach specialist and take help. So we had to prepare our system for this also. Now I come to the COVID times. Oh, they were tough times. I could see a rise in various sort of mental health issues in people from all walks of life. Believe me, all walks of people were going through some or the other issue. If you take a housewife, she was suddenly very surprised that her husband is spending most of her time in the house and her children are in the house, and it's a change for her, to which many could not adjust. Children were taken aback because they were not allowed to go to the schools, and they were suddenly, shut down in their homes. People had to shift their workplaces from the offices to their homes, and suddenly their homes become their workplaces, and they had to adjust according to that. We could not go shopping, we could not go to restaurants, we could not go to movies. All this was not easy. So it took a toll on mental health of many people, and they could not meet their families for days and days. So it took a toll on mental health of people, and it manifested itself in various ways. Some people reported of increased anxiety, some people reported of increased stress, some people reported of having a feeling of despair, hopelessness. Some people reported of having a feeling of uncertainty, what will happen to them, what will happen to their jobs, what will happen to their families. And there was another segment, that people who were getting infected with COVID, and the family members of such infected people, and the caregivers of such infected people, they were having tremendous fear in them, which manifested itself sometimes very bluntly. And they were having tremendous fear that, oh, what will happen to this person who I'm so close to, or who I am, if this COVID doesn't get cured. So we all have to accept that this pandemic times pose another level of mental health issues and mental health challenges in the government system also, and in the community also. And some people just could not respond to it because they were shut in their homes, they had nobody to talk to. So this COVID times, this pandemic times, was very difficult for mental health of one and all. Some suffered more, some suffered less, but believe me, everyone suffered to some extent in these times. Everyone went through their own agony, everyone went through their own challenges, and then some overcame those challenges on their own, some had to seek help. So what we did as government in this time of pandemic to help people to resolve these issues. First was, Madhya Pradesh did not have a mental health helpline dedicated to mental health issues, where we had where people could be concerned. So we started a mental health helpline during this time of pandemic. It was started on 2nd April. Its sole purpose was that if you are going through any stress, any anxiety related to COVID or not related to COVID, you call up this helpline. We'll divert the call to a counselor, and the counselor will try to address your problem as much as he or she can. So this helpline was started in the times of COVID, and I must say that it received huge number of calls. There were outbound calls also, like we proactively called the people, especially who were COVID infected or who were caregivers of the COVID, because we had their numbers, and we made sure that they are mentally stable and they are not going through an emotional turmoil, because 14 days locked up in a room and not visiting, not having seen your family, and it's terrible. So we made sure that they are emotionally fine. So we made proactive calls to those people, and incoming calls were welcomed to all the people who wanted to discuss whatever mental health issues they wanted to. So mental health helpline was one initiative which was started in the times of COVID, to help people go through these times a little smooth. Second, Madhya Pradesh has a system of clinics in the district hospital level called Mankaksh clinics. These, as I told you earlier, that we do not have available psychiatrists in all the districts. In rural areas like Anupur or Umaria, Dindori, the tribal districts, we don't have a psychiatrist working in the district hospital. But we have a setup of Mankaksh clinic at every district hospital in all 52 districts, where the medical officer is trained in basic mental health issues and how to address them. So we activated our Mankaksh clinics more in the times of COVID, and we made sure that the clinician, the MO who is trained in Mankaksh clinic, makes a visit to the COVID ward and talks to the people and hear out their emotions, hear out their fears, hear out their what they are feeling. So the active involvement of Mankaksh clinics, especially with patients of COVID and their caregivers, was enhanced during the times of the COVID. Thirdly, we are very fortunate that we have some organizations like Sangat and some other organizations who work very closely with the government in the mental health areas. So they were ever ready always to train our staff to tackle these problems, to build their capacity to address these problems. So we conducted many online trainings, we conducted some virtual Zoom meetings, and we made sure that let's get our staff know about this, that this is also an issue people can come up with during this time of pandemic. I mean, they must not be totally caught unaware that, I have to just look after the patient who's got a lung infection. No, a patient who might have a lung infection due to COVID might be going another level of mental stress or emotional turmoil that you can't imagine, and you have to address that also equally in an important way. So we continued our online trainings, and we continued our the virtual meetings with the frontline health workers, and sensitizing them time to time about, the mental health aspect of this pandemic also. Government of India started some helplines. Some of them were devoted especially to children who were going through a tough time, and then also to especially to COVID infected people. So we onboarded with those helplines of Government of India also, and we made sure that people from Madhya Pradesh know about these helplines and they call up these helplines whenever they need to. Then for training of the staff, Government of India in collaboration with NIMHANS started some training courses also, especially to look at the mental aspect of this COVID pandemic and to train the staff in this. We took this opportunity and we got our staff trained through NIMHANS and build their capacity, enhance their capacity to tackle with these issues. The most important thing is that I think we were sensitive and we were aware that such a thing exists. So we were all prepared that, people might come up with these problems during this time, and we have to be very sensitive towards them and we have to take care of them. So that was the approach basically. So if I had to sum up the approach that Government of Madhya Pradesh adopted during the times of COVID for mental health, that was to be available to the people in terms of physical availability and helpline availability, to train our staff with the help of organizations, with the help of NGOs, to tackle the mental health issues, and to collaborate with Government of India wherever we could to help this issue. So this was the approach of Madhya Pradesh government. I would not say we have succeeded 100% and we've been able to, manage all mental health related issues in the times of COVID, but I'm happy that we could address at least some issues, that we could talk to people. So there were around 2 lakh proactive calls from the mental health helpline, and there were around 60,000 incoming calls which we attended. Sometimes they were not related to COVID, but we did not ignore that call, and we listened to them, and we tried to help them. We tried to keep the morale of our counselors also high and up, that they are also COVID warriors and they are also doing a great job, so that they don't feel that, only the uh, people who are working in the COVID wards are the important warriors of COVID. We made sure that we talk to them time to time, and we make them realize that they are as important as any other clinician or anesthetist, as medicine, and their job is equally important. So these were some of the things that we tried to imbibe and we tried to implement at the ground level in the times of pandemic. We were fortunate to have help from Government of India. We were fortunate to have help from organizations like I mentioned, like Sangat, and we were fortunate to have officers at the high level who were sensitive towards this subject and who immediately agreed upon that, we should go after this and we should implement this and we should not just let it hang in there. So I think in that way we were fortunate. We are not done completely. We are maybe some way through, but we are making progress. So that's it from my side. Um, the major thing, times of COVID and how we responded to that uh, in Government of Madhya Pradesh. I'm open to questions.
Thank you so much, Dr. Saloni, for speaking to us in quite detail about your own personal intersections with mental health, right from your medical training to your training as an IAS officer, your initial postings in district levels, and then talking to us at the state level, the kind of issues that you've been facing and how you've been trying to respond to them with other colleagues in NHM, and also specifically around COVID-19. Very illuminative and helpful to start the discussion. So I was just looking up the statistics for mental health. There was the National Mental Health Survey, which was conducted in 2016. And for Madhya Pradesh, what it shows is that there's, the estimates were that mental morbidity in adults is close to around 14%. There are around 66 million adults needing mental health services in Madhya Pradesh. The number of mental health professionals available is around 1.2 for a lakh population, and the psychiatrists are 0.05 for a lakh population. So clearly this sort of reinforces what you were saying, that there are multiple challenges on the human resources side, and especially getting psychiatrists to serve to provide mental health services can be an issue at the district level, also because MP is largely a rural and partly tribal state as well. So one of the things you talked about was was what we call task sharing, which is working with frontline health workers, training them in mental health. But I know the other plan you've been also thinking about with other colleagues in NHM is sort of involving the new cadre of community health officers and seeing how they can probably be providing mental health care. So I was wondering if you can speak to the larger picture issue of what else can be done to deal with the human resources challenge, and then maybe more specifically around the role community health officers as they're being recruited could play in the health system with regards to non-communicable diseases and specifically mental health.
Yes, thank you so much, Dr. Anant. I would touch upon that issue. To tell you all about what is community health officers. So this concept of Ayushman Bharat health and wellness centers came up, which was primarily that we have to set up health and wellness centers at every sub-center level. And they have to concentrate not just at the curative part of the diseases, but preventive part of the diseases, and it especially focuses on the wellness of the people. That's how mental health component became very important in the tasks to be performed at a HWC, which is a health and wellness center. Before that, as you will see, sub-centers hardly took any interest in mental health issues. But health and wellness centers have very clearly defined job in terms of what they have to do for the mental wellness of the community. So a person who mans this health and wellness center is called a community health officer. They are generally at the rank of staff nurse or pharmacy or nurses students. So they are not doctors, they are community health officers. They can be from the Ayush also, or they can be from the cadre of the staff nurses also. They can be cadre from the pharmacists also. So that criteria is defined by Government of India from time to time. So we have completed recruitment of around 7,000 CHOs in Madhya Pradesh, and their curriculum was defined by Government of India, and thankfully their government, the curriculum had the component of identification of mental health disorders, mental health issues in the community. On top of that, we made sure that when these CHOs were being trained and when they were being taught, they are especially taught about how do they address the mental health issues in the community. I will give you some example. So, Government of Madhya Pradesh launched a Nirogi Kaya Abhiyan, which was basically for the identification, screening, and treatment of non-communicable diseases. Government of Madhya Pradesh recognized that mental health disorders are also a form of non-communicable diseases, and frontline workers were given training for that. CHOs were given training for that, and they were asked to fill a form for each individual called CBAC form, which had a component of how well they score on the mental health sheet. So, we are increasingly becoming aware that our old pedagogy or andragogy, as you will call it, for our health professionals did not have a mental health component as a large part. But now, when we are recruiting new people, especially CHOs, recruiting them at sub-center level or HWC's level, um, we are making sure, our Government of India is making sure that they are trained well in identification of mental health issues as well.
Great, thank you so much. One of the initiatives I know which has taken off quite well, all of us are now doing so many webinars, we're using digital technologies very frequently, is the proliferation of telemedicine. So, the erstwhile Board of Governors of the Medical Council of India, which is now dissolved, but at that time in March, also came out with guidelines which allow telemedicine. So the role of telemedicine and how it can be also used as a method of trying to address the shortage of human resources. So telepsychiatry, availability of professionals through the telemedicine route at district level or sub-district level. Is that something Madhya Pradesh is exploring even in the mental health space?
Yes.
And if yes, what is your experience with it?
Yes, so we are exploring the option of telemedicine for our sub-centers and for health and wellness centers for PHCs. Right now, through a platform called eSanjeevani, which is made by Government of India with the help of CDAC. So we have implemented it in most of our PHCs. So we are making sure that people come to a PHC, and if they need any specialized consultation, they just talk to the specialist for this telemedicine and use this window of eSanjeevani for specialist consultation. As of now, to be honest with you, we do not have many psychiatrists on board in this teleconsultation initiative, and most of the queries related to mental health are still addressed by MD medicine people. That's an honest answer. But we are trying to board doctors of each and every speciality in the initiative of eSanjeevani, so that each speciality is taken care of. And we are also doing IEC, the information communication activities in the districts to make people aware that now they don't have to go to a district hospital or even a larger hospital for any specialized services. They might take the first recourse from the primary health center. So in terms of mental health, I would say we would need much more psychiatrists to come on board telemedicine so that we can have a specialized consultation for psychiatry and mental health diseases.
Sure, thank you. There's a bunch of questions around stigma. He spoke to stigma and discrimination being a major issue. And probably there are three kinds of questions, so maybe I'll take them sequentially. The first one is sort of at the personal level. There is still a lot of stigma with accessing health services. So one of the questions is around, how do we deal with that? People are reluctant, either themselves or even sometimes family members are reluctant to go to a psychiatrist or to a mental health specialty hospital or to a specialist of any kind. So, any thoughts from a personal perspective or also as a policymaker, how can we address stigma at the personal societal level?
So I would say that I will speak first from a layman's perspective, how do we address these issues? We have to get talking about it. That is the first thing that is most important, that we have to understand कि ठीक है, जैसे बुखार हो गया, जैसे आपको खांसी हो गई, टाइफाइड हो गया, वैसे ये आपको हो सकता है. It's okay not to feel okay. That is the most important thing. We as a generation who's in mid of the new generation coming up and the old generation, we have to understand this is our task to let the oldies and the newbies coming know that you cannot feel happy all the time, you cannot feel positive all the time. So it is okay if you're feeling negative, if you're feeling a little low on some days. First of all, it's okay. But as long as this feeling of negativity, this feeling of lowness, this feeling of sadness, this feeling of despair does not let you commit any harm to yourself or to any other member of your family, sometimes it's okay to feel so. Okay, so that's the first thing, that I understand my emotions. I understand my thing that today I'm not feeling well. And not feeling well जरूरी नहीं है कि मुझे बुखार ही हुआ है तो ही not feeling well. I'm just not feeling well. So, but if it continues for certain days and if it persists for certain days, we should understand that there might be something wrong and we need help. So I would call it help first. So what is the help? First, we need to approach our family. And as rightly it told, there is a lot of stigma attached in the family about it. So in most of the communities, at a personal level, you should try to convince them that, see, I'm not feeling well and this is what is happening with me. And this is not something that is in my control and I can take care of at my level and myself. So I need help. So let your family be with you. But if they don't, you have to walk this path alone. Then you should understand that if not family, talk to your friends. If your friends also don't understand about this, you have to walk this path alone. That's why I'm saying it's very important to go to a right caregiver, which can be a counselor, which can be a psychiatrist, which can be a psychologist, which can be a general MO, which can be a MD medicine. Approach the right person. Tell how you are feeling, for how long you are feeling like that. जब आप इतना बता देंगे ना, तो स्टिग्मा जो आपके अंदर है वो तो खत्म हो जाएगा. क्योंकि जब तक स्टिग्मा आपके अंदर से खत्म नहीं होगा, तब तक आप किसी और के अंदर से खत्म नहीं कर पाओगे. तो आपके अंदर से वो फियर चला जाएगा कि I have something to hide. No, you don't have something to hide. You don't have to hide it at all. So first, when you become this brave that you let it go out of you, then only we can influence the community and the family and the friends that there's nothing wrong in being depressed. I'm seeking medical help for being depressed. That's fine. That's like having typhoid. That's like having jaundice. That's like having any other disease. It's fine. I'll take medicines. I'll be okay. So you be brave and you face this, that it's okay. I'll be fine. I am fine. And if some days I do not feel fine, that's also okay. And I will speak to a specialist. I will seek help when necessary. Then only you can change the community around you, the family around you, or the friends around you, and take your first step in destigmatizing the mental health issues. And from a government perspective, I think governments are increasingly becoming sensitive towards this subject, and they are paying a lot of attention towards this subject. And they are doing so by creating awareness in the people, by opening up more help centers, by opening up helplines, by creating posts for psychiatrists, counselors, and psychologists, and creating the manpower, and by training the existing manpower as to how you can identify the mental health issue in a person and what basic medicines, जैसे आप बुखार को डायग्नोज करके थर्मामीटर से उसको क्रोसिन दे देते हैं, ऐसे ही बेसिक उसकी क्या आप हेल्प कर सकते हैं before you refer that person to a specialist, that is being done by the government. So that's a step towards destigmatizing this issue, I guess.
Yes, sure. And maybe linked to that, because as I was saying, there was probably questions around stigma at 3 levels. The first level was the individual level. If someone has a mental health concern and they want to access services, how to deal with stigma within the family, and also sometimes maybe a reluctance to be seen as someone who's accessing mental health services. There were two other questions which were sort of related. One was something you alluded to, which is the fact that while psychiatry is something we all learn when we do our MBBS, those of us who are medical doctors, we are also not exposed to it in great detail. And I think also within many tertiary hospitals, perhaps there is not enough interlinkages with the psychiatry department. And to some extent, we can also say that within the medical profession also there is a certain stigma about mental health, and maybe not enough understanding about referrals, and sometimes understanding that might be some symptoms might be mental health issues rather than actually physical health issues, etc. So what can we do differently in medical education? If I were to ask you as someone who also underwent medical education, what can we do differently to enhance the profile of mental health within the way we train our doctors?
Thank you so much for asking this question. It's very close to my heart because I always felt that as a medical graduate, I could not understand psychiatry and mental health issues as in depth I should have been. And that's not to blame my alma mater, that's not to blame my institution and my teachers. They didn't teach me well. I was, maybe I was not known of the importance of psychiatry as much as I was known of the importance of medicine and surgery. Maybe because in medical education, psychiatry is a small subject. It does not fetch you as big marks as in medicine and in surgery or pediatrics or other major fields. So it's not, it's very easy to get marks in subject. In PG, while we are preparing for Indian PG also, like there are not many questions of psychiatry. So we are truly, there are not many questions of psychiatry. So we are hardly bothered to study this subject. Also, there's a reluctance in terms of teachers of the mental health professionals. Sometimes, I'm not saying it in a generalized way, but there is a reluctance कि अभी इनको ये बता के क्या करेंगे. If she is going to be a gynecologist, जिसको क्या लेना देना है कि mental health. We don't understand it's a holistic thing. A person with any comorbidity can have mental health issues and is bound to have mental health issues because if you are suffering from fever for 15 days, I'm very sure that you will not feel good. If you are having a stomach ache from past 20 days, you're bound to feel bad also. So but in the medical college sometimes it is seen like that कि ठीक है ना, मुझे तो गायनी करनी है, मुझे तो पीड्स करनी है, मुझे साइकेट्री से क्या लेना देना. Lately the approach has been changing and we are realizing day by day that every field needs basic understanding of psychiatry as we need basic understanding of anatomy, biochemistry, physiology. So psychiatry should be a basic which should be taught to all fields, PG students of all fields. And but before this dawns upon us, it was, I think it's a personal view and opinion that we have not given in our medical education curriculum much stress to the psychiatry, and we have not told people and told medical graduates about the implications of studying this subject and implications of using it in whichever field you go. I mean, you can be a dermatologist, but say if you encounter a patient who's under great stress due to something happened on her face or his face, then you are bound that you cure the face and you cure the mind as well. So I think it should be made basic and compulsory, and it should be taught in coherence with the other subjects. And medical graduates should be made should realize and should be made realize that without this knowing this you cannot go forward. It's as basic as anatomy and biochemistry. As far as stigma around mental health in medical colleges is concerned, I personally never felt it in our college. So I don't think I'm a right person to comment on this.
Sure, and maybe hopefully that is how it will be for most other colleges. Okay, the third segment around stigma was more to do with the community setting. You know, we talked more about the individual level. We talked about sort of the medical college, medical education scenario. You talked a little bit around also how the government is trying to respond to that. But any inputs from your own experience of of serving as a policymaker at the district level, how we can deal with this whole issue of stigma and discrimination for mental health issues, or sometimes even a misrepresentation? As you were saying, sometimes especially women are branded as witches, etc., when all they need is probably good quality mental health care. So how can we change those perspectives?
Um, so first of all, you know that what I realize is that government has a limited mandate in reaching out to the houses of the people. I mean, as a government servant, you cannot reach house of the people and tell him that, you know, you think like this. If your wife is doing like this, you think like that, or your husband is doing like that, you think like that. That's the domain. We should understand that we have our limitations, and we should take help from other people. By other people, I mean who have a greater approach to the people, who have a greater penetrance into the houses of the people, maybe NGOs, maybe some social groups, maybe civil society. So we should not hide away, or we should not shy away from taking help of NGOs and civil society and social groups in furthering the cause of the mental health. That is one. So once you engage these institutions, now at the community level, it's very important to make people understand that that there are problems associated with mental health that exist, and this is not something which has come from above, or it's not something which is supernatural. So as I told in the first place, you have to tell people, because right now they are really ignorant about it. So you have to tell people. After you have told them once, you have to reiterate these things time and time again, and you have to spread the message in the community time and time again, because believe me, people have a very short memory. All of us have a very short memory. So you need to reiterate this message time and time again. So whether you are a government institution or you are a NGO working in mental health, so you have to reiterate that you reach people out every now and then and make them understand that these kind of issues do exist. It's okay to have such an issue, and to approach a health facility for this issue. So reaching out to people, talking them in their language, that is also very important. I was in Chhatarpur, which is a Bundelkhand region in Madhya Pradesh, and I would see some organizations over there which would talk in English with the people, and they would just not understand. It's not about the language, I tell you. It's about how you connect with the people. So if you don't connect with the people in their own way to start with, they'll start repulsing you. So you have to connect with the people in their language, through their customs, initially at least, to build a rapport amongst them. So that's my advice to all, you know, all mental health professionals also who are working in and out there in the community, that, you know, if you have to reach out to the people and make them understand your voice, make them understand what you're saying, initially you have to do it in their way. You have to understand their rights, rituals, customs, language, and just approach it and know why they are doing so. So that's very important for the organizations to reach out and penetrate in the community. So that are two things, that you keep repeating the message you want to circulate in the community time and time again, and you do it initially at least in their way. Then only when you are being heard, when you have been heard for some time and you think you have that authority in the community, you can only go and teach people and force upon some things which are mandatory and which are not right on the people.
Okay, we're starting to get a flood of questions now on the chat window. But you know, another area I know you have been interested in is the issue of addictions, and obviously addictions is also related to mental health. And I know addictions is a major issue in Madhya Pradesh: tobacco, alcohol, etc. So, what is the government doing for the addiction space, and how is that response being ramped up? Especially because in COVID-19, also we know that there are chances that addictions might have gone up.
Yes. So thank you, Dr. Anand. That's very true that this is again a matter which is very close to my heart. So I come from Punjab. So let's be honest about it. It was one time a land of addiction, of substance abuse. So that subject is really close to my heart. So, but in Madhya Pradesh, the prevalence of substance abuse is moderately high. Uh, First step which government is doing uh, to address this issue is setting up addiction treatment facilities in the government setup in state of Madhya Pradesh. As of now, we do not have any addiction treatment facility in the government setup in state of Madhya Pradesh. We are very happy that centers of excellence like AIMS, Bhopal have decided to collaborate with NHM and government of MP to set up the first addiction treatment facility in Miss Road in Bhopal, and they will be coming up with such facilities in districts. So this is the first thing. Then obviously we are creating more awareness in the people about the substance abuse, and wherever we need to, we are going very harsh on the people, on imposing fines, on imposing the legalities of the law, to make sure that they are kept under a check. So it's a demand and supply thing. So you take care of the demand side, that people do not fall into the trap of substance abuse, and if they fall into, then you should have the facilities to take care of them and to treat them. So government of Madhya Pradesh in its initial phase is trying to address both these issues by opening up addiction treatment facilities and by creating awareness in the people, and wherever it needs a tough hand, being tough on the people to not allow them go into this trap of substance abuse.
Great, thank you. There was a very interesting question on the chat window, which was trying to find out that have you seen if the data has been analyzed? That is, that was there any gender distribution in the calls that were received by the helpline, as well as by the individuals who went out to the quarantine facilities, etc. The reason, I guess, is also because we all know that intimate partner violence, domestic violence, etc., has also increased during the pandemic. So, was there any gender differential so
It's a
far as
very
has been
good
seen?
observation, and yes, we did realize that in the initial days when the helpline was not very popular, we were getting mostly male centric calls, and they were related to totally COVID. And as the helpline became very popular, we, as I told you also, we started getting calls from people from all walks of life, especially females, uh, especially housewives, that we are going through a lot of problem which is not directly related to COVID, but which is but which is indirectly related, because I have so and so going in my family and I have to bear at 24 hours. So that was a challenge for us, that though we started this helpline for only COVID patients, we could not ignore the people and the call for help which was coming from other walks of life, and especially the women in distress, who were saying that because of COVID, this is what we are indirectly facing. So there were more calls by the females. There's a clear pattern in that, and in that also we had more calls from the age of 21 to 28.
Very interesting. Thank you. So, there was a set of questions which revolve around the fact that we know that there are certain segments of population, especially those with prior existing diseases like TB, leprosy, HIV, which are already stigmatized. And now they have concerns about potentially contracting COVID, which also brings its own stigma. So is there a way also to then maybe ensure that we are able to respond to their concerns around stigmatization, their anxiety, etc., in a way that those programs which are targeted maybe at those diseases can also incorporate a mental health response and being sensitive to this?
Yes, as I told you before also, we are enhancing our Mankaksh clinics in the districts to reach out to the people who are infected with COVID or with other ailments to address their mental health issues. We have specially deputed counselors in the COVID wards to take care of the mental health issues of the COVID patients. And the growing fear among certain vulnerable population, that's also being taken care through the mental health helpline by making proactive calls to them, and by making our district hospitals and civil hospitals as much equipped as we can with the manpower and with the training to deal with these issues.
Okay, so one animal which is always difficult to tame is the issue of quality. We can do all our services that we want, but how do we ensure that they are of a minimum quality, especially because there are challenges, as you have already highlighted, in the public sector, uh, a variety of constraints. So how do we get our quality game to be also, on the rise? Because we know there are always complaints about quality in many mental health as well as general public health facilities. And what is
You're
being
very
done about that?
right. You're very right, Dr. Anant. I would say there are two basic things to that. One is a very individual approach. At last, we all are human beings and we all have our prejudices in mind. And sometimes, being a doctor does not remove those prejudices. And if being a health worker does not remove those prejudices. So, if as an individual you had certain prejudice towards mental health issues and you tend to become a health worker and you continue with those prejudices, then it's very difficult to change those mindsets. And we try that, at least they don't hinder in their work while they are delivering health services. So one is that. Second is, honestly, I tell you, right now we are such short in quantity that quality is not much of a concern for us because we are such short in quantity. But having said that, I would not say that we are totally going blind on the quality. We are making sure that our health workers, when they deliver mental health package or mental health services, they deliver it of the good quality. We do some random third party checkups also, we get patient feedbacks also, and of course we have organizations who are working in this field and who tell us how our mental health workers perform, and we continuously try to enhance their capacities and try to remove their prejudices, so that we cannot be very tough on our limited staff, on our already limited staff. So we want that we should know why they are behaving in a certain way, and then we improve their quality. We are taking help from the organizations, from NGOs, from civil society. We are taking help from third party. We are taking patient feedbacks, and we are continuously engaging them in trainings to improve their quality.
Great, thank you. Now one of the things we know where mental health certainly comes to the forefront is this whole issue of stress around exams. Right now we're going through this whole series of, and it's often in newspapers as well. A lot of parents, a lot of students who are giving competitive exams, feeling stressed about the pandemic, exposure to risk, requests for postponing exams, and this is also something which there's a whole season around February, March where there is a lot of anxiety, there is a lot of stress. Unfortunately, we lose some children to death by suicide as well around examination season. So is there a requirement to have mental health incorporated in school education? And if yes, how can we do it?
Yes, it is of very much, and it's of prime importance that high time we inculcate the subject of mental health, and while we train our teachers, we train them to identify signs of stress and anxiety in the children and how to address the basic stress and anxiety problems. I think it's high time that education sector is made aware of the mental health issues, and they are incorporated in teacher training and in the student learning also. For example, I would tell you, in government of Madhya Pradesh, there are certain books which are being published for 7th class onwards, which are for manovigyan, that's your how to for your mind wellness. Also in diet colleges, which are the teacher training colleges, a special course on understanding the stress and anxiety causes in children is being introduced. The government of Madhya Pradesh education department is working on that. Government of Madhya Pradesh education department also launched a helpline called Umang. uh, their base counselors were there, and which became activated in the last board exams, and that helpline was basically to help people, to help children and to help students during their tough times, and to address their mental health issues and any sort of issues, not academic issues. So Umang, I guess it became very popular also, and it was staged well in the national media also. So I think it was a good initiative and it worked really well. I hope it will continue this board season also. So I think small initiatives like this are necessary while we are doing a major collaboration between the mental health sector and education sector for training our teachers and for learning of the students.
Thank you. So, one of the questions is around the fact that we know that a lot of stress is also being accrued by health professionals and healthcare workers who have an increased workload, who have an increased risk of during the response to COVID-19. Are there any interventions or activities which are planned, which are targeted at health professionals, including probably mental health ones?
Yes, we have set up this helpline, and it's open to health professional also. If they are feeling stressed or burnt out at some period of time, we are making sure that they call upon this helpline and talk to the counselors. Also, the civil surgeons of the district hospital and the authorities of various hospitals have been made sensitized that your staff will get burnt out. So while there is a aspect of quarantine leave, you just give them a little space after they have performed their duties, and you give them a break after they have performed their duties. It's a good sign that I have got this report from many districts that the authorities of the hospital, the civil surgeon and CMHOs, they are continuously engaging the doctors and people or healthline workers in a talk. So it's not just that your work is going unnoticed. So they are engaging in the talk. At the state level also, there are continuous efforts to acknowledge the work done by these people and to motivate them, to keep their morals high. So these are small things that we are doing. So we have sent out appreciation letters signed by Honorable CM to all health workers. So these are small steps, but they definitely boost up your morale. And the higher officials have been made sensitized that you have to take care that your staff is not burnt out.
Great, thank you. That's very good to know. So, you've just taken over as the CEO of Ayushman Bharat, and there were some questions which dealt with the fact that one of the concerns many service users have in the mental health space is that perhaps mental health often gets excluded when we talk about health insurance. That's both in the private sector as well as through the government policies. So, what can we do differently to ensure that it's not so much exclusion but inclusion even within the health insurance policies?
So, when I was reading about it, why it was decided in very old times also, health insurance companies also kept mental health out of their purview. Why it happened? It was written somewhere that, it is very easy to feign mental health problems. So there was always a chance that insurance companies could get deceived, and that's why they wanted to keep mental health out of their purview. Second reason is people themselves did not want to disclose what they are going through. So, for example, if I am going through depression, I do not want to have it in my health insurance policy, which is done by my company. I don't want my company members to know that I'm going through depression. So, these are two causes as far as I understood, that were mental health was kept out of purview of insurance. So when Ayushman Bharat came, because it was either a trust model or an insurance model, so the same principles persisted for some time. But thankfully, when this concept of health and wellness centers came, and the packages in Ayushman Bharat were revived, the new set of packages do take care of the mental health problems and do take care of inclusion of mental health subject in the reimbursement and in the packages of Ayushman Bharat. So I think it's a good sign.
Great, and hope that that will keep expanding. So I think there's a very interesting question around intersectionalities and the practice of medicine and public health, probably. And this is a question around the fact that one, you did talk about the fact that sometimes there is a lack of community interventions, And perhaps especially for those communities which might be historically marginalized. So these might be communities like LGBTQI communities. These are communities facing caste discrimination, and sometimes in a tertiary hospital where specialists are, there is a lack of sensitization towards understanding some of these social determinants of illness and of mental health and lack of well-being. And perhaps the response is a very medical response, which is around, the psychiatric medication, but perhaps not understanding that there are other predisposing factors, especially social ones. So is this something which can be addressed in the ongoing training for health professionals and for the new cadre like CHOs, which are supposed to be working at the community level, so that they have a more well nuanced understanding of predictors of health and well-being?
Yes, absolutely right. As I mentioned before, also that if you want to work in the health sector, mental health sector, especially whether you are an organization, whether you are an NGO, whether you are a health worker, you cannot ignore people's beliefs, people's culture, people language, people's rituals. You cannot just ignore them. So first, you have to get accustomed to them. You have to understand where they are coming from, why they are suffering so, what what is the what is the reaction of the family towards such a such suffering. So you have to know all the social predisposing factors that have led to such and such problem. For example, if you women who undergo domestic violence very often come under depression. So while depression is a symptom, the root cause is domestic violence. So till the time you don't look at the societal cause of that predisposing disease, you will never be able to solve it. So that's why I believe that my best friend also told me, it's very important for psychiatrists to talk to the patient, to listen to the patient. So I think psychiatrists have a great patience and they listen to the patients. So all helpline workers, we are also trying to teach them that while they have very limited time to examine a person when they go house to house, they must make sure that they listen more and speak less. So once you have listened, then only you can respond to people. And we are trying to inculcate this. This cannot be done by any formal training. This is all part of informal and soft skills which we have to teach time and again to our frontline health workers. But we are sensitive towards it, and we are trying towards inculcating this habit of listening to the people and to their problems and understanding where they're coming from.
Thank you. So, there's a few questions by individuals who are very interested in contributing and supporting mental health activities. So, there's some individuals who are trained as mental health professionals, but they are wondering about, how can they contribute? Is recruitment being planned? If they are not going to necessarily join government services, how can they work with the government and support them? And even questions from individuals who might not be mental health professionals, but are public health graduates, community medicine graduates, and they're very interested in working in the mental health space, either IEC activities, etc. So how can they support the NHM and policymakers like you in enhancing mental health in the state?
I'm very pleased at this response, and I'm really happy that people are voluntarily coming up to contribute their services towards this important issue. One way, if they want to work in the government sector, we have some posts coming up in the field of mental health as psychiatrists, as psychologists and counselors, the details of which are available on NHM website, NHM Madhya Pradesh website. So you can check out those details on the website. And if you want to plan to work in the government sector, you might as well apply, and there are handsome salaries also. Secondly, if you are not so much willing to work with the government, then I think Dr. Anant is a better person to answer this, how you can work with Sangat and organizations like that and come in touch with government indirectly. And third is, even if you don't want to work with the government sector, you don't want to work with organizations also, then there are some channels where we require your help voluntarily. For example, when we were asking counselors and psychiatrists to voluntarily help for this helpline, so there was a huge positive response. So you should look out for those things, that when there is a call for help from any sector, you are available there. But I think if you don't want to work with the government, it's a good good thing to get associated with some organization who's working in mental health space and just be with them, and whatever they are doing, you can contribute it with them.
Great, thank you for those tips. So, maybe now coming to a slightly difficult question, which is the question of resourcing. That's, I think, a challenge for any government and also for policymakers. There are many competing challenges around where to spend the money. And obviously, each sector wants more money to be spent on them. So those of us who will be working in mental health will say, Dr. Sidana, as a policymaker, you should get more funds to be spent on mental health. So, how can that be promoted as an area where there is a need for more expenditure? More seriously, we know after the COVID experience that certainly both at the central and state level, more money needs to be spent on health. And as a doctor yourself, I'm sure you will agree with that. But how do we ensure that, one, we get more resources for public health and mental health specifically, but also spend them more efficiently? What are your thoughts on that?
There are two things I would like to tell you. First, I would like to burst this myth that there's shortage of fund. It was a myth with me also. I always felt that, there might be shortages of funds. But when I came to NHM, I realized that, in mental health sector, especially, the funds have been going unutilized for many years. So we have not utilized the funds. So that's a myth, A. So we have been going with the unutilized funds because there are hardly any activities, there are hardly any interventions which are done or have been taken up in this sector. So that's A. B, thankfully, till now with the government, there has not been a resource crunch in the mental health subject, either from the state government or from the central government. There has never been a resource crunch. But as you rightly said, during the times of COVID, we are anticipating that funds from different schemes might be cut and they would be put in COVID response, and some schemes might suffer. So, A, we are preparing to fulfill that demand from the state government, and B, we are trying to utilize the funds efficiently, and we are trying to rope in many stakeholders and different partners who can help us utilize our funds efficiently and just not allot them to a particular activity which will never be carried out. So, A, we are making sure that we allot funds only for the activities which are carried out, and B, we are taking help from the experts, organizations, etc., to help us doing the fruitful work at the ground.
So, a lot of policy making essentially is driven by data, and data is always useful, I'm sure, at the state level as well, when you're deciding about what to focus on, etc. What can the research community do, especially those who are working in mental health? What kind of data points would you like to see? What kind of research would you like to see happening more of, especially in Madhya Pradesh, which can help you with policy making at the state level?
Okay, so I see the very less researches centered around mental health that have taken place in the past, especially in Madhya Pradesh. So I would like to welcome through you new fellows and new researchers and anyone who's interested in any research. There's some things we would like to see, especially the mental health pattern in our tribal districts. Madhya Pradesh has largest number of tribal districts in India, which is 21. 89 blocks are tribal districts. So what are different health challenges they are facing, and how have they been addressed and and how they like to address them is one sector. Then, as somebody also mentioned, I would be very interested in looking at the gender component of mental health problems and the distribution among two genders. Then maybe third component I would love to look at is the child psychology, because as you clearly told, this is becoming a grave concern in nowadays. So I would like some research on the child psychology and how is it being uh, affected by the social media, the TV, the mobiles, and all these things, and peer pressure, of course.
And maybe, sorry, okay, and linked to that maybe is this question around, those of us who work in the research domain, how can we better advocate our findings and recommendations, whatever evidence we gather in a way that these can be communicated to policymakers effectively and be used to then, launch a policy response. Because, we can do all the research we want, but unless those are translated to policy, it won't make much of an impact. So what is the best way to, reach policymakers like yourself?
Just come to my office.
And for those of us who might not be able to, any suggestions for policymakers like you? What's the best way to communicate?
Reach out to the policymakers on their emails. Nowadays, everyone is reading their mails quite diligently, and so am I. So you can reach out policymakers. They are very interested. I can say from my perspective and from my MD's perspective that we are very interested in bridging the gaps between the academics and what is happening on the ground. So we take care that, we read research papers and we try to disseminate the findings of research papers among the health workers. So if you are interested in sharing your research with us as Government of Madhya Pradesh, you can email me your research paper and I'll be happy to get back to you.
Excellent. Very good to know that. And also because you're trained as a doctor, I think that is one step lesser, because you'll probably understand all the jargon which is used in many of these papers. All right. So maybe I'll end the session a bit early because, it's always good to give you time. I know it's a busy Monday and, you've been very kind to give us almost 90 minutes of your time. It's very much appreciated. There was one question which was about people who want to become policymakers. So this must be probably a young student. What can someone who is aspiring to be a policymaker like yourself do to pursue their dream of being a policymaker who can make an impact in mental health?
You study hard for your exam, UPSC exam, so that you enter into this. Nowadays, there's a lateral entry also. But you have to understand that whatever level you are working, if you work sincerely towards the cause, you are in a way contributing towards making a policy or implementing a policy. And you are doing a great job by doing your work, whatever work you do by sincerely. But still, if you are very interested in becoming the policy makers, do study very hard for UPSC and clear the exam, and welcome to the services.
Thank you. And on that positive note,
I can't hear you, Dr. Anand.
Sorry. I got muted for a while. No, I was just going to say thank you so much on that positive note for joining us and sharing your perspectives. It was very, very insightful. We're getting very positive feedback on our chat window as well as social media. It was very, very pertinent to listen to you, get your perspectives around your perceptions around mental health, the challenges, and what are the kind of responses which are being launched, and what more can be done, and how can stakeholders in this space support you in positive change, in bringing more focus to mental health. So very much appreciate your time, and thank you so much for joining on behalf of.
I would like to thank Sangat for giving this opportunity to me to reach out to people and to enlighten me also what people think and what people have the queries in their mind. And honestly, I would love to read your research papers. You can get in touch through Sangat and get my email address and reach out to me. And we'll be happy to work together in the subject of mental health. And thank you so much, Dr. Anant. And thank you so much, Sangat and ESSENCE.
Okay, thank you so much. And thank you everyone for joining. It was a pleasure hosting you in this webinar. This will be part of a regular webinar series. All of you who are registered will get updates on the following webinars which are scheduled. So take care and have a good week. Bye for now.